Go ahead and get started. Good morning, everybody. Thank you so much for being here at this month's roundtable. We're talking about travel, and we're very fortunate to have with us Lori Schultz from RII, who has been engaged in a lot of the conversations that have gone on at the university administration level about the travel policy and what's most appropriate. And we're all, I think, intrigued, excited, maybe faintly nervous about the changes in the travel policy now that allow domestic travel with just a department head authorization. So no need to go further than that. International travel is a different beast and is, of course, not just our own University of Arizona policies, but then, of course, we'll end up with some making sure that we are being aware of where we're traveling and what other countries' policies may be as well. But I wanted to start off with a quick poll. Who here has actually traveled on an airplane or a bus long distance or some other form of mass transit in the past year? Has anybody done that? One, two, couple of you. How was that experience? Chris, what was it like?
Well, so mine was relatively early on. So I'd say post time when travel restrictions and mask wearing had become more standard. And so I'd say that it was a reasonable experience. Everyone at the time was, at least my travel experience, the airports were relatively empty and people were willing to adhere to social distancing. And so I don't have a necessarily contemporary view of like the last month, but certainly early on it's pretty reasonable.
Regina, was yours more recent?
Good morning. No, mine was actually, it was the past fall and then again over winter break.
Mm-hmm.
So, but yeah, I would, and I don't know if it matters, I flew American, and I would say it was mixed, the response, right? I think there was some people that were very, very cautious and I mean, double masked with, shields and what have you. And then some that were willy-nilly unmasked and, conversing with whomever. And then certainly on my flight back here, people were sick. I mean, you could hear people coughing underneath their masks. So that was fun. Yeah, do not suggest, but maybe it's better now, hopefully.
Well, hopefully there's fewer people sick at least. Yeah. Lori, was yours more recent?
No, it was around the fall. And I found that the airplanes were fine and people were compliant. It was the airports that were more challenging, just getting around the people. And again, some people were compliant, some people weren't. But on the airplane, most people were doing what they were supposed to be doing.
Good. Elena, do you have a comment?
So recently we went to Texas about 3 weeks ago, and we flew American, and they were really strict about everything, which was great. But I found that nobody didn't have a mask. Like everybody on the plane had a mask. It was on the way back where they were coming to Tucson that it was like, oh, just right under your nose or something. But even then, it was one person that I noticed throughout the whole plane. So I felt pretty safe traveling with my family.
Yeah. Good. Well, I'm about ready to take my first airplane trip over Memorial Day weekend. Going to take American to Texas and go see my in-laws, whom we haven't seen in about 2 years. So I want to make sure to get that in, and I'm curious what it's going to be like. American keeps sending me stuff talking about how safe they are, but of course we know they're going to send that. Well, Lori, if you wouldn't mind, could you just tell us a little bit about what the thinking is behind the current policy and where this came from and maybe where you see it going, if you know any trends that are likely?
Yeah, so I think, where we were before this travel change was still a restricted travel in that, you could only be traveling for certain purposes. And then there was approval of the college leadership, and then RAI, if it was research related, and the provost office is a final stop for both domestic and international travel. And as, vaccinations rolled out and CDC guidance started to change, we had been kind of awaiting that to reevaluate the travel policy. But there were a couple of other U of A things that were going on at the same time that we felt like as soon as the CDC guidance is updated around what to do in travel if you're vaccinated or you're not vaccinated, we wanted to make the change. And the two things that were happening at the U of A is, one, the amount of travel that was being requested going into summer. I mean, it's been over a year for a lot of researchers, and this summer in a lot of ways is sort of seen as a way to salvage some things and to catch up a little bit if that's at all possible. And for many of our academic appointed faculty members, the summer is the time when they can do things. And there was no appetite unless things were really, really bad case-wise in Arizona and elsewhere. There was no appetite to make people wait what is essentially another year. And the other thing was that we evaluated a number of travel requests before the policy changed. Literally did not have to reject a single one. No one was asking unless they needed to do it. Like, we weren't even getting requests that were not reasonable. Every single one was well justified, time sensitive, and sometimes at the last minute because, like, there was a volcano in Iceland. We had people who went up because that happened. So, it was all about what was happening in the research, the seasonal nature of some of the data, the relationships, or just, we had one going up to Alaska because if you wait too late in the summer, the ground is frozen. So, like, there were all these factors that made the time a real important factor. And we just, again, we never said no because they were all really good. There was a lot of trust built up because people weren't just saying, I'm going off to do something just because I'm, cabin fever, which is probably true for a lot of us, but no one was asking for that reason. So we, in talking with the provost office, it's like, as soon as, she wasn't comfortable relaxing until the CDC guidance said something about travel. And at that point, we made the case to say, listen, people know what they need to do at this point. No, we've all kind of figured out how to live in this world. And if the travel needs to happen, it needs to happen. And so at this point, we want to make it easier, pull some of the processes away, because it was getting really challenging for everyone in the travel chain to know what they needed to do.
Great, perfect. So now it's just up to you, your department head, just kind of do a sanity check on this now. Have the criteria for travel changed at all? Is it still essential research only, time sensitive only, or?
No, we took those criteria away.
Right.
So it's really at the department head's discretion, which is, both the activity and the budget for the activity. Mm-hmm. Although for research travel, everything we saw was on grants. So the budget was less of an issue previously. So yeah, there are really no restrictions other than, what needs to happen and when. And, and for a lot of people, we're still not seeing, even when people ask me questions about what they're doing, I'm still not seeing where people are all of a sudden going to conferences. Because either there's just not a comfort level, or the things they would normally do at this time of year are still happening in a virtual format anyway. So.
Great. Other questions for Lori about this? So what's happened? Oh yeah, go ahead, Chris.
Well, I suppose we'll chat on this at some point during the time, but I was gonna, since Jennifer mentioned international travel, and that's a whole nother beast. I was wondering what the thinking is. I mean, you mentioned travel to Iceland, which was research justified. Mm-hmm. What about things like field courses that mm-hmm. faculty might want to do, or study abroad, that sort of thing?
Yeah, and I think that would be allowed. So the ITSOC process for international travel is still the same. So there was a layer of approvals for international travel that has always existed, COVID or no COVID. So that is still true. And you still have to go through the process of filing it in Teradata and that whole workflow of getting it reviewed, and then the risk of it reviewed by by Global and by the companies that they contract to do that. So that's the same as it ever was. Again, there's still no criteria for essential. There's just the acknowledgement of needing to understand what the rules are where you're going and whether or not you can even enter. And a lot of that, they've relaxed the criteria, and they've also relaxed the proxy function in Teradata. So before they did that, like if you were traveling, you would have to go in and do it yourself, like someone who couldn't assist you. You couldn't delegate that out and say, could you fill this out for me so that we can get this moving? So they fixed that. So they've made that a little bit easier. I think when there was still restrictions, they wanted the traveler to be deeply involved in every piece.
Mm-hmm.
Yeah. And I think, depending on the time of year and why the travel restrictions and why we've lessened them is that, especially in our U of A community, we have such a high rate of vaccination that in the beginning with travel, part of the conversation was that Arizona was at a point where we were some of the highest caseloads in the world. And part of the conversation was, are we putting where we're going at risk by traveling instead of the traveler being at risk, which is another conversation. And for a certain point in time, a lot of folks felt like Arizona was traveling out of Arizona and taking it with us to another community was maybe riskier than the traveler potentially catching it where they were going.
Wow. Yeah, and if you have questions, please just pipe up or raise your hand, or you can put them in the chat. I see Elena has already put a chat in about Texans not always wearing masks. Yes, my in-laws live in the little town of Granbury where they don't believe that COVID exists. So I'm well aware of that, unfortunately. I have another question, Lori. So sometimes I get a little confused about travel for work purposes versus personal purposes, and the whole idea of course, those two, although you can separate them in terms of whether or not it's travel required for your job or paid for on your grants versus just going to visit family, but obviously the two are not completely disentangleable. So could you comment on that a little bit?
Yeah, and I know that the travel office is still saying to not combine personal and business, like extending the trip either direction because, of whatever personal reasons you might be also traveling to the area. So that restriction still exists. Although I think that that's probably something we need to reevaluate based on a number of other factors, including CDC guidance for when you're traveling while vaccinated and when you're traveling while not vaccinated, because even the number of days quarantine for unvaccinated people has changed. So that has loosened up a bit. And I think that part of the travel process is, again, not being in the business of knowing whether or not you're vaccinated, but giving you the guidance of what to do if you are or you aren't, and whether or not you need to quarantine on either end if you are or aren't. And I think that the personal travel is sort of with that in mind, but that feels like the next thing that will get taken off the restriction list.
Great.
Yeah, and the policy does indicate, like, if you're vaccinated, you're not required to test before or after or quarantine upon return. But for unvaccinated, they recommend testing before and after. And obviously, anyone with symptoms should quarantine. That's just best practice. I think that by the time we get to fall, assuming we don't spike again and have another crazy caseload happening in the state or the county, I feel like travel will be back to normal by fall.
Okay, that's exciting.
Prediction. Just seems like the way it's going. I mean, international, of course, depending on what's going on, where you plan to travel is anyone's guess. I mean, I know that they say that that Americans should be able to enter the EU by summer, but it's not clear how that will roll out, both for per leisure travel and for business. Although business is easier. Kate asked if we can't ask about vaccination status. Yes. That's what the expectation is. I mean, we're in a really weird time in that your vaccination status is your personal health information. And we don't want, we, the U of A, does not want any department having to store that information, because then all of a sudden you become a HIPAA outlet. Like, what you do with that information, how you store it and secure it and not share it becomes a problem. And no department that isn't already doing that with patient data, because that's their job, should have to do that. So yeah, we shouldn't be asking about it. But the weird part about it is that what I'm observing is many people are willing to share it. So if they share it, they share it. But yeah, we shouldn't be asking or even making a decision on work assignments based on vaccination status, because I think there is a concern that if there's a perception that vaccinated staff member A gets something that unvaccinated staff member B doesn't get because of that, then we may have a problem.
Okay, but I think, you know, there are some circumstances like human subjects research with Banner where it's required, right, by Banner. So that's I assume a little different beast.
Yeah, because in that case, you know, they are asking for a bunch of different other reasons, and if they're storing that information, they're storing it in a way that, you know, they already understand what the rules are. Whereas if you have an HR consultant in a department who has this information, that it's a much higher risk.
Mm-hmm. Yeah, that's just interesting because in my lab, we have a protocol that requires going into Banner. And so we actually do have a little spreadsheet of who's gotten all their vaccine. COVID is just one of the many they ask for. So I didn't think of that being private health information that we're storing, but I guess that's a little beyond the subject, but that sounds like something that we need to look into and make sure we're doing that properly.
Yeah, and for areas where vaccination is required as a part of the work you're doing, it is different because, and again, where there may be Banner, it may even be Campus Health, who understands what those records are and may have even administered the vaccination if you need to re-up something. Yeah. And I think that over time, I think that this vaccine will be part of the list that people who are already used to being vaccinated for work reasons will be doing. We're just not there yet. So Elaine asked, have we gotten a good amount of people uploading their vaccination? There are a lot of people who have uploaded their documentation to Campus Health. More students than U of A staff and faculty, but we're getting there. It's yeah. Everyone was worried about students, but they are uploading their documentation more than staff and employees are. But it's still happening at a pretty quick rate. In terms of vaccination, most of you may know that Pfizer was approved for 12 to 15-year-olds, and Arizona can administer to 12 to 15-year-olds starting today. So if you have anyone that needs to get one, the only thing to be on the lookout for is that the U of A up to now has been walk-in, like you don't need an appointment. That may need to change if demand shifts, and that's the only thing. If we've got a lot of people who want their teenagers vaccinated, then they may need to reinstate more appointments just to manage the flow, because it's just Pfizer that's approved for that age group.
Okay, yeah, I thought the U of A pod was going to be shutting down here soon. Is it going to
it'll probably go until at least the end of June because of this. Yeah.
Oh, perfect.
The hours have shifted. So it's only indoors at Gidding, and it's 10 to 5 every day now instead of into the evening. But yeah, so we will probably be until the end of June because of this. And I don't know, since we're doing Pfizer only, we'll probably be taking a lot of the load of 12 to 15-year-olds in Pima County. So, yeah.
Great. So any of you all who joined recently, do you have a travel experience you'd like to share? What was it like? How safe did you feel? If it was airplane or train or bus, or were people compliant?
I can share a bit. Hi, I'm Eric I was a student, but I withdrew this semester. But my travel experience, I drove to New York with a friend from Tucson during the short break we had, and it was rough because we wanted to fly, but we chose not to. And then we realized how unsafe everyone was in other states. And so that was a bit scary. And so I realized that if you do fly, you just have to sit with yourself the whole time and not talk to anyone. But driving wise, interacting with people is very difficult in general.
Interesting.
No matter how safe you are.
Yeah, that you found that just at gas stations or restaurants or hotels or something, you might have been actually exposing yourself more than getting on an airplane, where apparently at least some airlines are enforcing the rules pretty strictly.
Yeah, so I
100%.
Yeah, so Eric, I was thinking about driving east at one point up to Maryland, and I didn't do it. I didn't have the time to do it. So I ended up on Delta, and they had a policy where they kept the middle seat open, but I had to stop off in the nation of Texas on the way there. And what you described, Dr. Barton, there were people in the airport who didn't have masks on there. And some of those people worked for the airlines, but once we got on the flight, and this was Delta. Delta was particularly good. Everybody followed the rules, but it's just the stop off in the airports and where you end up, so I felt safe. I felt safe on the flight. But when I was in the airport, it was a different story.
Mhm.
Yeah.
Great. Well, what about international travel? A little bit more on that. Anybody have any thoughts on where the things are likely headed? I mean, I understand that India is still in the midst of just a horrible outbreak. We've have a colleague there who's ill and taking care of his ill family, and it's just kind of a disaster. But so I don't suppose that's going to be opening up anymore. But where on the planet can we fly to right now, or travel to? Has anybody been to Mexico? How was that experience? No international travelers. Okay. All right. But in general, Lori, I assume that, with the international travel, the whole regular process that you go through will obviously find out if there's any restrictions on that end.
Yeah, because they can help navigate through that. And also if there are any considerations for coming back to the US, depending on where you're going. I mean, because I think that, India is a good example of, there might be a pressing need to be there and you might be able to travel, but what will you face trying to come back to the US? And I think they can help navigate through that, because that's also something that's changing quite a bit.
There is another issue that I wanted to bring up as a family experience. So my wife is not a US citizen, and her mother was sick with COVID, and it was her mother's last days. And so she had her testing done to meet the provisions of, I guess the consulate has these rules. And so she arrived at the airport, and there was a 72-hour interval between the test and the travel required. And when she arrived, she arrived at 74 hours, and there was something about the transport. I wasn't there at the time, but we also have to be aware of the fact that, and she was going to France. Okay, so this is Western Europe. So if we are traveling to places and we do need to provide evidence that our test would, I think we have to really be careful about that, because they wouldn't let her on the plane, and her mother passed away. So these are important things that we have to consider as well. Not only our personal safety, but sort of the validation that these countries need that we are safe to travel. So
I'm so sorry, John. All right. Well, I think that I totally agree with Lori, though, that there's been, lots and lots of research that we've put off now for a year. And I don't know how many other people are in no cost extensions on their grants with things that they weren't able to accomplish in the last year, and desire to travel. I've got a situation like that with collaboration with Johns Hopkins University. So, I'm ready to go, but they're not actually ready to receive me yet. So, but hopefully by the end of the summer, that'll be happening. Does anybody else have plans to travel this summer, or something interesting that they're going to be working on? You mentioned field work or field courses. Chris, is there something that you're hoping to go attend?
Well, I'm hoping to get my field course that I developed elsewhere built into Arizona. That wouldn't be until summer 2022.
Okay.
But my understanding, and Laura, you certainly have supported this notion, is there are a lot of administrative approval process along the way. And yeah, so I'm looking longer term, and we'd like to think, knock on wood, that by summer 2022, things we're not having conversations that we're having summer 2021, but that does not necessarily mean as such. But I am looking forward to getting back to Peru if possible. So one of the we have all sort of globally, I think, suffered from the restrictions that were appropriately put on travel. But I heard yesterday, for example, that the tour company that I've worked with for 30 years in Peru is down to 1/10 of their staff and hanging on, because they of course have no without tourists, without the scientific folks that I bring, the undergraduates, and they don't have sources of income. So there are lots of things that will, once we get moving, can prime the pump to getting a number of different economies going, not just our own research, which is important.
That's a really good point, Chris, because I've just heard, the devastating effects that the pandemic has had on the entire trade show and conference community, event planning community. It's been devastating, and it will be interesting if we want to get back to those types of things. And those people have been laid off and moved on to other things, and we can't find enough qualified people to actually run the quality of programs that we need. Yeah. So yeah, that's another good question. How about conferences? What are your technical societies saying about when they're going to have in-person conferences again? My first one that I've heard about is SPIE Optics and Photonics is being planned for the beginning of August in San Diego as a hybrid, but that'll be their first conference to have anybody in person.
Yeah, I just went through one that was a disaster, Jennifer. It was just terrible. A lot of it has movies, so some of this is, physiological imaging. And so they rely on, in this bandwidth, that we're pushing up against these bandwidth constraints. And people were like, well, the movie works well on my computer, but it's been really hard. And so yeah, that sort of thing is tough, but I know that at least in my field, they are making mini conferences. It's not these mega, Society for Neuroscience, Experimental Biology, and SPIE is another one. I'm glad they're doing that in person, but it's just not the same. To when your computer crashes, you're waiting to see this phenomenal adaptive optics thing, and it's like a frozen image. So it's been hard. Yeah, disaster.
So this is Krishna. ASMS is hosting in-person conference this year. So generally, there will be 5,000 to 10,000 people gathering on a normal situation. Right now, they are planning in October, last week, November 1st week, something like that. So they are planning to do this. I am not sure whether I'll be attending it or not.
Mm-hmm. Yeah, that's the decision we're all going to have to make, I think.
Yeah.
Right. Anybody else?
And we are actually have a SRI meeting, a Society for Reproductive Investigation. They're having a combination format where there's the online form and there's in-person form. However, the registration fee is the same if you have to register online. So you basically have to pay a lot to just see the frozen Zoom video. So it's a real, how to say, yeah, I'm really not sure. So I'm kind of waiting for the last moment to see who is actually going in person, because a lot of people decided to not go in person. And it's hard to know who gonna be there, and kind of worried to be the only person showing the room. And in the meantime, it feels wrong to pay for so much just to attend a Zoom section. And I have a colleague who got an oral talk from our previous group, and then And he's truly debating, should he go or should he just record his presentation? So it's tough for us.
Yeah. Sitting on I sit on the strategic planning committee for SPIE, and which is it's a big optics organization, and so they have these massive meetings. Photonics West is 25,000 people, and that it's a financial consideration, right? It doesn't cost them any less to run it virtually. I mean, they don't have to pay for the event space, but the costs of developing the infrastructure to do it virtually were enormous. And so all these organizations are trying to figure out, they initially had their conferences free online because they just wanted to serve the community, but they rapidly figured out they were going to go broke if they did that. And so then they started bumping it up. So the virtual was only a little bit less than what the normal was. And yeah, I wouldn't be surprised if everybody goes to the model of, hey, it's a conference you want to attend, it's one price, whether you come in person or not. And maybe gambling that they'll incentivize you to travel in person. But yeah, the gamble is that you just don't participate at all. Well, okay, so Kate, you have a question. Do we as U of A have guidance on visitors coming to the campus from other states or countries? Oh yeah, thank you so much for bringing this up, Kate, because we actually have, a group who wants to come film in the Keating building.
Yeah, so the visitors basically need to follow whatever U of A guidance there is at the time, and the U of A does not like parse it out by country or state. Basically, if what they're doing is reasonable for the unit, whatever's happening, and they're following distancing and masking. There is a visitor Wildcat well check form that they can do online. We recommend that for the checking and the reminders of if you have symptoms and all that sort of thing. Again, we should not be asking if they're vaccinated. They may tell you, but we shouldn't be part of that. Shouldn't be part of the criteria. But yeah, you can say no if you feel like it's not a reasonable use of the space, or that they're not going to comply. But the restrictions are really all the ones we have coming into work every day for those of us that are coming to work. I do expect after commencement is over, there to be more guidance about external parties coming in and using U of A space, but that may be more things like use of the mall and renting buildings from people outside the way that they did in the past before COVID. But none of that'll happen until after graduation's over.
So I have another question. It's not travel related, but we've also put off a lot of this media, the filming, things like that, or we've done it with masks, which is fine, but we're getting more and more people who are like, I want to create an evergreen video of my lab that's not going to be dated by me wearing a mask, and you can't hear me very well, la da 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 da. Is there any process for requesting exceptions to that wearing masks indoor rule?
I think the best course would be to talk to the folks in RLSS about the activity, to evaluate the length of time, the room they're in, to do those kinds of things, because they can help guide through the process to make sure it's as safe as possible. And it may be as simple as, okay, when you're filming, you don't wear the mask, but then when you're not, you always do.
Mm-hmm.
Yeah, they can provide guidance there.
Yeah, I know. It's just I feel like there's this building up of pressure of people wanting to do things, but everybody understands that safety is first. All right. Any other questions for Lori while we have her here? Or for me, or questions for each other? That's part of what this is about, is getting tips from each other. Okay, other thoughts at all? This is our opportunity to chat, but I know we've got a jillion other things on our plate, so we don't need to make this go any longer than it takes to kind of get stuff off our chest and find out information. Okay. I'm not seeing any. So I think with that, we'll just go ahead and end. Thank you again so much, Laura. I really appreciate that. Thank you everybody for attending. It's great to see your faces on the screen, and you know, hopefully we'll see you in person around soon.
And anyone, please feel free to reach out to me if you come up with a question that you're not sure how to answer around all this stuff.
All right, great. Well, thank you, everybody. We'll talk to you later.
Thank you. Thanks.
Bye.